Hi, I'm Becky, one of the nurses at Akron Digestive Disease Consultants. If you are a week out from your procedure and you have not received any information or your prep kit, please call our office so we can make sure to get that to a local pharmacy for you. You've been referred to us or are seeing us because you'll be having a colonoscopy. A colonoscopy is a procedure that's super important to your health. One of the most important factors to having a colonoscopy is to have a good prep or preparation of your colon. So we're going to be discussing that today. If you are prescribed a different prep than SuTab, please refer to our website, which will be at the bottom of our screen, or you can call our office to obtain those instructions. You should have been prescribed 2 medications, SuTab and Zofran. The SuTab is the actual colonoscopy prep that will clean out your colon so that our doctors can get the best exam possible. The other one is in case you get a little nauseated during preparation, you can take that as directed and as needed. Please refer to your prescription for those exact instructions. Go ahead and get your prep sheet and we're just gonna work column by column together. So the first one, 7 days prior, you're just gonna confirm that you have your SuTab and your Zofran. The Zofran is optional, so if you chose not to pick that up, don't worry, you'll be just fine with the SuTab. As far as blood thinners, those are gonna be listed here. Please speak with our office prior to holding any blood thinners. We will have contacted your prescribing physician and we would get the okay for that. We do want you to stop all fiber supplements 7 days prior, and those are listed here, some examples. And the most important thing you're gonna do a week before your procedure is confirm that you have a driver, because you will be sedated for this and we will not allow you to drive home. Three days prior, we get quite a few questions about this. Stop consuming a lot of high fiber foods. The reason for this is that they're hard for your body to break down and they can make your prep harder. A few examples of those are, we do not want you to have raw fruits or vegetables, no nuts, popcorn, no bran or bulking agents, and that is all listed here for you in column 2. Any other food option that's not on that list, you're welcome to eat 3 days prior. It can seem daunting to try to hold all high fiber foods or bulky foods, but really just think if it's a food that could make my prep harder, you might want to avoid that a few days ahead. Now we are going to talk about the column that says 1 day prior. This is the most important day of your prep because you're going to wake up and be on clear liquids. Do not follow the instructions on the box. Please refer to the instructions on the paper because the day before, when you wake up, you may not have any solid foods. You're going to be on clear liquids. A clear liquid is anything that you can hold up to the light and see straight through. Some pops are fine, but milkshakes, for example, are not a clear liquid. Another important thing to note on the day prior is the diabetic instructions. So we don't want you to take your oral diabetic medications, and we do want you to take half of your regular insulin dose. And that's written right here in this top section for you to review. At 4 p.m., you're going to begin by opening up your box, and you will see 2 bottles full of 12 tablets each, and the cup that you can refer to for easy measuring. You're gonna put one of these away for tomorrow. Between 4 and 5 p.m., you're going to fill your cup to 16 ounces and you're going to drink this over the next hour. The amount is not as important as just being hydrated. So if you've been drinking all day clear liquids and you're feeling a little queasy and you don't really wanna drink more water, that's fine. Just make sure you're well hydrated before starting the prep to ease nausea. At 5 o'clock, you are going to fill your container back up and you're going to begin taking the tablets 3 to 4 minutes apart over the next hour. After the 12 tablets are gone, you're going to take 1 Gas-X tablet that you will have picked up at the pharmacy. It is over the counter. For steps 3 and 4, we do mention over the next couple hours drinking more liquid. We've given you amounts to make it easier, but if you just want to drink over the next few hours, that's just fine. It just helps keep you hydrated during the prep. I can't say that enough, just drink. Every single person is different, so we can't tell you exactly what time you'll start having bowel movements after finishing the 12 tablets. There are more details if you need them on the sheet. For the day of your procedure, and that is the last column on the prep sheet, one important thing, again, for the diabetic patients, do not take your oral diabetic medications. And if you are insulin dependent, do not take your morning dose of insulin. You'll be repeating the steps you did the day before. The only things I want to bring your attention to are the times. And we've left a blank spot there so that you can enter your time in based on your procedure time. So 7 hours before your procedure, you're going to begin drinking some more clear liquids, again, just to make sure you're hydrated. And 6 hours before, you're going to begin taking your tablets. You can reference the fourth column, but that's the main idea. You may continue drinking clear liquids up until 3 hours prior to your procedure. You must stop anything by mouth 3 hours before your procedure, or it may be canceled. To ensure you have the best prep possible, please stay hydrated even the few days before your prep. If you happen to be checking your sheet a few days before and realize you maybe had a salad or a handful of nuts a few days prior, don't worry, just please increase your fluids and you should be just fine. If you're wondering what your bowel movements should look like to ensure you're cleaned out, the morning of your procedure, you should be going a clear yellow liquid for your bowel movement. If you finished all your prep and you've not had a bowel movement, please call our office. Likewise, if you are still having muddy brown stools or formed stool, please call our office prior to coming to the procedure center. We may have to adjust your prep or reschedule your procedure. If you're like many people, your procedure is in just a few days and you've quickly found your packet and this video, and you're going to panic a little bit because you realized your multivitamin has iron in it, or you've taken some ibuprofen. Don't worry, no need to call in. Iron in a multivitamin is just fine. You can just stop it once you realize. Same thing with the ibuprofen. If you've been taking your prep and have began vomiting, please stop, wait 30 to 40 minutes, and resume your tablets. You may also, per the Zofran instructions, take a Zofran 2 hours before you start your prep to avoid that issue. On the back of your prep sheet, you'll see a green box that addresses what a clear liquid is. The best way to say it is if you can hold it up to the light and see through it, it's a clear liquid. For our preps though, we also want you to avoid, in addition to a non-clear liquid, something that is red or purple. Thank you so much for watching this video. Make sure you're checking the time of your arrival and the time of your procedure, and feel free to review that sheet we sent home with you so that you have everything you need the day of your procedure to make your day go smoothly.